Eyewitness News and Hartford HealthCare present Coronavirus in Connecticut, your vaccine questions answered.
Good evening, everyone, and thank you for joining us for this special Eyewitness News special. I am Erin Connolly. This has been a huge week in medicine with the arrival of the first COVID vaccines at hospitals around the country and across Connecticut. In the next 30 minutes, we're going to get answers to some of the hundreds of questions you have sent our way. But we want to begin by speaking with the head of Hartford HealthCare, the biggest health system in our state. Jeff Flaks is president and CEO. Jeff, we appreciate you being with us tonight.
Oh, good evening, Erin. My pleasure.
So first, let's talk a little bit about Monday. A historic moment, a very big day. What did it mean to you to see those vaccines going into the arms of your frontline workers?
Erin, it was hard for me to describe. I called it the dawn of the new day. It was such a phenomenal moment, a historic moment. To imagine it was 9 months, just 9 months since we had our first patient admitted within Hartford HealthCare, and the accomplishment for this country to be delivering that vaccine and to see the very caregivers who cared for our first patient and who were there that night getting the vaccine, it was just absolutely extraordinary and something for us all to be very proud of. And it's an incredibly important step forward.
It was an emotional moment for many, too. And we know your system got enough vaccines in this first delivery for about 2,000 members of your staff. When do you expect more to arrive, and how many are you expecting?
Yeah, we're thrilled. We're getting about 11,000 next week. So it's another important step forward. So we have a significant number of vaccines, and we have a process set up to get it to as many of our frontline caregivers as we possibly can, as fast as we can.
I know you announced plans yesterday about what could be done if there is a surge. What is the status of COVID-19 in your hospitals right now? Are cases escalating, especially after Thanksgiving and right before the holidays?
Certainly. So, Erin, post-Thanksgiving, we did see an uptick within our testing of a higher prevalence level. So we saw about 8% of the people being tested became positive, which was about a 2% increase from prior to Thanksgiving. So we're very sensitive to the importance and the need for vigilance during this time period, particularly around the holidays. But right now, today, we've been increasing about 5% a week of numbers of patients we're caring for. So it's plateaued a bit in terms of the escalation, but we're still at about 75% of what was the peak in the spring. So we do have capacity. Our hospitals are safe. Our teams the people working in the front lines of healthcare today are doing an extraordinary job caring for people.
That is so great to hear. And lastly, Jeff, I wanted to ask you about all of the frontline workers. They have been tirelessly working since this pandemic started, dedicating their lives and putting their own health at risk. What do you say to them for all of their efforts over the past few months?
Erin, words can't describe it. I really have a hard time finding the right words to say. I try so many different ways because people who work in healthcare, they're a different breed. When I see the devotion, when I see their commitment, their bravery, their courage, it's really difficult to put into words. We all owe an incredible debt of gratitude now in this moment during this crisis, but truthfully always for the work that they do. And these are incredibly gifted, talented people, but their devotion to helping others is really what defines them.
Very well said. Jeff Flaks, the president and CEO of Hartford HealthCare, thank you so much again for everything you and your colleagues have been doing all year long. We appreciate it.
Oh, thank you, Erin. It's an honor. Thank you.